Hi, today we're going to discuss cystic fibrosis, the health problems related with it, diagnosis, and treatment. First off, cystic fibrosis is one of the most common severe chronic lung diseases in young adults and the most common fatal hereditary disorder of Caucasians in the United States. Individuals born with cystic fibrosis usually become symptomatic within the first years of life. The median age at diagnosis for cystic fibrosis is currently 5.3 months, and the average life expectancy is 37 years of age. Patients with cystic fibrosis have a higher risk of developing bronchiectasis. So cystic fibrosis is an autosomal recessive disorder, which means that a copy of the mutated gene must be inherited from each parent for a child to be born with cystic fibrosis. Cystic fibrosis is caused by causes abnormalities in a membrane chloride channel that results in altered chloride transportation and water flux across the apical surface of the epithelial cells, primarily in respiratory and gastrointestinal tracts. Cystic fibrosis affects the tissue that produces mucus secretion. Almost all exocrine glands produce an abnormally thick mucus that obstructs glands and ducts. This results in glandular dilation and damage to tissue. Chronic inflammation and infection cycle in the lungs results in irreversible damage to the airways in cystic fibrosis patients. Some systemic effects occur in the respiratory system, the endocrine and metabolic systems, gastrointestinal, and reproductive.
Next, we're going to talk about the identification of cystic fibrosis, which includes the signs and symptoms and the diagnosis. Infants and young children may present differently than young adults, and I'm going to point out the main symptoms from this list. Infants and young children with this disease often have the following symptoms: poor growth or failure to thrive, a delay in passing meconium, bulky or foul-smelling greasy stools, persistent diarrhea, wheezing, dyspnea or chronic cough, and frequent respiratory infections. And in young adults, they may present with cough, sputum production, hemoptysis, decreased exercise tolerance, sinus disease, diarrhea or constipation, and abdominal pain. Now, to make the diagnosis for cystic fibrosis, two positive sweat tests on 2 different days are required for an accurate diagnosis. And a normal sweat test does not exclude the diagnosis, so further genetic testing is used for the confirmation. Some laboratory findings that may confirm cystic fibrosis are arterial blood gas. This may show hypoxemia and chronic compensated respiratory acidosis. Also, pulmonary function tests may show mixed obstructive and respiratory pattern, a reduced forced vital capacity, a reduced total lung capacity, a reduced airflow. The sweat test also can confirm cystic fibrosis. It's a quantitative pilocarpine ionophoresis sweat test, and this reveals elevated sodium and chloride. Chest x-ray findings early in the disease may show hyperinflation, and later in an advanced disease may show peribronchial cuffing, mucus plugging, bronchiectasis, increased interstitial markings, small rounded peripheral opacities, and also focal atelectasis. And finally, a pneumothorax may also be seen.
So let's talk about some treatment plans that are available for cystic fibrosis patients. Currently, conventional treatment programs focus on the following areas. Firstly, management of the symptoms to improve the quality of life for these patients. Clearance and reduction of the lower airway secretions. This can be done by a variety of methods. Chest physiotherapy, which involves postural drainage, chest percussion, or vibration techniques, are used frequently. Also, direct cough. There's also reversal of bronchoconstriction using bronchodilators. Treatment of respiratory tract infections using a variety of antibiotics. Also, replacing pancreatic enzymes is key in some patients. Prevention of interstitial obstruction, and nutrition and psychosocial support. Some of these will include high-calorie, high-protein diets, about 1.5 times the recommended normal intake, vitamin supplements, about double the recommended daily allowance, and also being liberal on salted foods for patients. Also, the flu and pneumococcal polysaccharide vaccine are highly indicated for patients yearly. Sometimes lung transplant is the final option for most of these patients.
Here are some questions to test your knowledge of cystic fibrosis. Cystic fibrosis is caused by a mutation in the gene for the protein cystic fibrosis transmembrane conductase regulator. This gene is required to regulate the components of sweat, digestive juices, and mucus. What symptoms could this disease lead to? The answer is A, diarrhea, infertility, difficulty breathing. Sinus infections, diarrhea, infertility, difficulty breathing are all symptoms of cystic fibrosis because they result in the inability to regulate the components of sweat, digestive juices, and mucus. The next question is, the sweat is a diagnostic confirmatory test for cystic fibrosis. The test is measuring what? The answer is A, the concentration of chloride that is excreted in sweat. Cystic fibrosis patients have defective sweat glands. The chloride channel is defective and does not allow chloride to be reabsorbed into the sweat ducts. Therefore, in patients with CF, there will be an elevated sweat chloride in the sweat. The next question is, what is the most common pathogen for causing secondary bacterial infections later in the course of cystic fibrosis? And the correct answer is A, Pseudomonas. Pseudomonas is the most common pathogen for causing secondary bacterial infections later in the course of cystic fibrosis. Some of the other bacteria listed can cause secondary infections earlier in the course of cystic fibrosis, and some of the other pathogens listed cause other infections.
And that concludes our presentation on cystic fibrosis.